Today on Dueling Doctors, 3 distressingly persistent health issues that almost every teen, including me back in the day, has been troubled with at some point or another. Acne, depression, and the infamous kissing disease, mono. What causes these problems, and more importantly, how can we treat them? Doctors from the world of holistic, natural, and conventional Western medicine square off about how to take charge of your teenage woes. It's time for a little breakfast club confab that will have your 16-candle kids feeling pretty in pink. Next. It's holistic and natural versus conventional health experts with different opinions and one goal: to help you live a healthier life. Dueling Doctors. Hi everyone, I'm Dr. Frank Spinelli. Each week on Dueling Doctors, experts from the worlds of both conventional and natural medicine debate and discuss the best ways to treat what ails us. Today's topic, teen troubles. Let's begin by introducing our guest. Here to represent the conventional approach of Western medicine is mother of 4 and practicing pediatrician at the Washingtonville Pediatrics, Dr. Suzanne Cassetta. And here on the holistic side of the equation is the president of the New York Association of Naturopathic Physicians, Dr. Danielle Wilson. Welcome, ladies. Thanks for being here.
Thank you. Great to be here.
Okay, so it is Teen Trouble Day, so we're going to begin by showing what we look like as teenagers. I think we have your picture first, Dr. Cassetta. Let's take a look. Well, very nice. That's a nice 80s hairdo. Lots of, how many cans of Final Net? About 2?
2.
2, 1.
Yep.
All right, and then we're going to show yours, Dr. Wilson.
Okay.
Let's see what we got. Oh, the cheerleader. I like that. Very pretty. You haven't changed a day or a week. And then finally, in all fairness, get ready. Here it comes. Wait for it. Whoa! That's a child that has to be exported back to Cuba. I don't know. Oh, okay. This is the double denim look. As you can see, it's 2-tone denim. Very hard to pull off. And that is the Flock of Seagulls hairdo. That's 3 cans of Final Net, 2 holes in the atmosphere. All right. Let's begin. Our first topic, acne. Every teen's worst nightmare. Acne is a skin condition that occurs when your pores become plugged with oil and dead skin. Acne may occur anywhere on the body, but most teens are troubled by facial acne. Acne lesions heal slowly and resolve on their own, but some teens experience persistent patches known as cystic acne, which can be quite distressing. So how do we prevent and treat pimples? Each of our doctors has an opportunity to present their treatment plan, and then the other will be given an opportunity to respond. We flipped a coin before the show to see who would go first, and Dr. Cassetta, you're up first. Let's face it, teen acne is probably the worst thing that can happen to a teenager.
It's true.
It's one of the most embarrassing things, and it's sort of like, it really is like the rite of passage for teenagers.
Yes, it's very common in puberty.
I mean, most teenagers probably won't go to a doctor. They'll treat it themselves. But
initially.
Let's say someone comes in and says, I have acne, I want to know what I can do.
Sure. Actually, the most common thing is children come in for other reasons, and I ask them, is your acne bothering you? And they all say no. But
because they don't want to talk about it.
Yeah, that's not true.
So what do you recommend they do? Because you can't cure acne.
No. Very important to teach people what acne is, and that it's not going to last forever. And like you said, the clogged pores, in puberty, because of hormones, the pores do get clogged because dead skin cells are more sticky and they stay in there, and there are glands that secrete this sticky, oily substance and clogs everything up. The clogging of it causes inflammation. That's the redness, and there are bacteria. And there are bacteria on your skin.
So the whitehead is like, it's really like pus, kind of. It's an infection.
Yes.
So do you recommend squeezing pimples for children? Absolutely not, right?
No, because it causes scarring.
It causes scarring.
And that's what you don't
could
want.
Get more of an infection.
Yeah, it causes more inflammation.
And then, so do you recommend like a daily routine? Like what they should do every night before they go to bed and in the morning?
Yes. Well, a lot of people think that their skin is dirty, so they really scrub it. We recommend not scrubbing your skin. That'll cause more inflammation. So normal, mild soap.
Right.
Clean your skin every day.
Because I think it's really important. It's not that you're a dirty person.
No.
You have acne.
It's not about hygiene.
And is it true what my mother used to say, don't eat chocolate, don't eat fried foods, because that really causes acne?
Well, there was thinking, like that was the way everybody thought, and then it was kind of the opposite. No, it doesn't matter. It's just, genetic, it's hormonal. And now there's some studies coming out that possibly things like milk and high sugar, but there's not enough evidence for me to say you have to change everything that you're eating right now.
And at what point do you prescribe oral antibiotics?
That's really down the line.
So it's a rare case?
Because they have to be on the antibiotics for about 4 months or longer.
And then what about oral birth control to control acne?
Yes, it is used. A lot of times I use it in children that need birth control
in the first place.
For other reasons.
Okay,
and
so
that's
not
like
as a first
bonus.
line to treat acne.
You could, if they had severe scarring acne, you could use it as a first line.
And then what about Accutane?
Accutane.
Which is a medication you take, it's orally. Isotretinoin is the generic name.
Right.
Lots of side effects.
There can be.
It's actually, you know, there is a lot. I mean, you can't have children because of the birth defects while you're on it.
Absolutely not.
High liver enzymes, high lipids or triglycerides. There's just one after another. It's like, why would I even go on this medication?
That's for certain cases. We have children who have like, you know, when people get older and they have pock marks on their face. I mean, they have acne in places where, like, the general teenager does not. Okay, down the chest, in their back. These kids often are going through a lot of emotional changes because of puberty, and sometimes Accutane actually makes a huge difference in their lives.
So psychologically as well as physically.
Yes, and we monitor them for all of those side effects, and if anything horrible is happening, obviously we just stop it.
All right, Dr. Wilson, I think in the beginning you probably agree with it a little, what Dr. Cassetta said. Diet probably plays a role. How do you feel about diet? Is it really chocolate? Is it really fried food that's causing acne?
Well, what I look at in terms of food is first food intolerances, which are different than food allergies. So it's not like a peanut allergy. It's delayed reactions to foods from the immune system, but it can cause inflammation anywhere in the body. So like we were talking about it, with acne, it's an inflammation and a tendency toward infection. But we can look at foods such as dairy and gluten being the most common foods that will
So it's really
make you more
dairy,
likely.
because you both mentioned dairy. Dairy is one of the things. So you would tell a child to decrease their amount of dairy intake.
They could start by trying to avoid dairy. They could also do a test. There's tests available to find out if they have these delayed type responses to foods like dairy and gluten and others.
And what do you think about something that's more natural that you could take either topically or orally?
Absolutely. There's sometimes it can be a nutrient deficiency that's involved in predisposing a teenager to acne. So I'd be wanting to look and see, are there any nutrient deficiencies? Even something simple like B vitamins and vitamin C. Research does zinc. The research shows zinc and vitamin A to be beneficial.
Vitamin A as well,
the thing is, I recommend working with someone with training in clinical nutrition to make sure you get the right doses, because those nutrients also, you know, there is such a thing as getting too much. So you can get it over the counter, but you want to use them safely. You want to use effective doses that the research shows can be safe and effective.
Anything herbally that you could prescribe?
Absolutely. I mean, definitely in terms of if it's a premenstrual flare of acne, one of my favorite herbs for that is called chaste tree berry, and that
chaste tree berry. I love this name. This is Vitex.
Vitex.
I love chaste tree berry because it makes it seem like you have to be chaste.
Yes.
To take it.
And it helps.
That actually helps with the balance of hormones.
It does, because it helps the ovaries produce more balanced hormones, and that can help. But they've also shown that B6 at a dose of 50 milligrams can help with premenstrual.
So with Vitex, chaste tree berry, because it affects the hormones, can you be on an oral birth control pill or be pregnant and take it as well?
You can, but usually you would use chaste tree when you're not on hormones, because the chaste tree is talking to
because I want to make that clear distinction. So you really need to speak to a doctor or an herbalist about that. And what about for boys? Because you don't want to use that on boys, correct?
For boys, a lot of times for boys, I'm coming back first to diet and sugar. I think you mentioned sugar. I would definitely say to minimize sugar, as well as nutrients. Sometimes with boys, I see just even getting them on a really good multivitamin makes a big difference.
What about using maca?
Maca is a possibility as well.
And it also like increases libido, though.
Yes, you want to make sure you get the right form of maca for males versus females. There's different preparations of maca.
Right. And so, what do you think about patients that say they want to go on Accutane?
You know, it's just like you talked about, it's concerning. I would say let's try all of these other things first, because before going towards something toxic, maybe we can get their acne to calm down with natural approaches.
Okay, well, very good. We have to take a break. Up next, how can you tell if your teen's broken heart is really a more serious condition? We're dealing with teen depression next. Very good. I love the idea of chaste tree berry.
I love that one.
I love that. Welcome back to Dueling Doctors, where health experts from the world of conventional and holistic medicine debate the best ways to treat what ails us. Today's theme is teen troubles, and we're back with naturopath Dr. Danielle Wilson and pediatrician Dr. Suzanne Cassetta to take on something more serious. Teen depression is a serious medical problem that causes a persistent feeling of sadness and loss of interest in activities. It affects how your teen thinks, feels, and behaves, and it can cause emotional, functional, and physical problems. 20% of teens experience depression. 30% develop a substance abuse problem as a result of it, and suicide is the third leading cause of death among 15 to 24-year-olds. Each of our doctors has up to 1 minute to present a treatment plan, and then we'll debate the pros and cons of each. Dr. Cassetta, you were up last time, so we're going to begin with Dr. Wilson. Very, very serious issue among teens, and it's even more so because I can't think about a month that went by last year where you didn't hear about a teen suicide.
It is. It's very scary to hear that.
So do you find teens come in talking to you about depression, or is it something you noticed during your visit?
Sometimes they come in talking about it, but a lot of times it's something you notice.
And is it really a matter of bullying that's going on? Is it social media? I find that when I went to school, kids got bullied. I don't know anybody that killed themselves. And yet I find that social media is more like bullying on a bigger scale.
No,
I mean, now people are going on Facebook and making fun of people, and it's just advertised. And I wonder what your approach is to that, because there's really nothing you can do about that. You can't affect their Facebook and social media. So what do you tell children, or what do you advise them?
Well, to me, a lot of that comes down to stress. And teenagers do experience and deal with stress just like adults do. And those are examples of the kinds of pressures and stress that can come into a teenager's life on top of hormone changes that are also occurring at the same time. So to me, I spend a lot of time talking with them about that so that they can have more awareness for this is their body responding to stress and how we can help their bodies in those situations.
So how much of this is affected by diet?
I think a lot of it's diet. I mean, first of all, there's blood sugar issues, because if teenagers are skipping meals or having high carbohydrate or high sugar beverages, their blood sugar levels are going to fluctuate more, and that's going to affect their mood for sure. And then there's food intolerances, where they may be having delayed responses to foods like dairy and gluten are the two most common. And research shows that dairy and gluten can both result in depression.
Correct,
So we have to look at that.
I find all too often by doing this show that I learned from a lot of the naturopaths that the gut is really the key to your mood because of the serotonin that's produced. And you bring up food allergies. So what would you recommend besides monitoring what they eat, that you could also bolster? What would you recommend as something to take as a supplement?
Well, the thing with depression is we often are thinking about something like serotonin, which is a neurotransmitter that you mentioned. And neurotransmitters are all made in the body from nutrients, amino acids, which are from proteins. So if we can test what the neurotransmitter levels are in that particular person, we can find out which amino acids that
so
are deficient in.
So are you measuring neurotransmitters like serotonin levels and what else?
Serotonin, epinephrine, dopamine,
really?
GABA,
So you're measuring
glutamate,
them for a depressed patient that comes in.
and
That's interesting.
cortisol, because cortisol, which is a stress hormone,
Stress hormone
is
produced
also
by the adrenal glands, which sit right above the kidneys, and they produce cortisol, which is the fight or flight response. Right?
And if you have variations, either high or low cortisol, it can create depression.
So could you give them that class like adaptogens to bolster adrenals? Like which ones particularly?
Well, so say if the cortisol is low, then we would use an herb like rhodiola, for example. It's so important to know that we can actually measure these neurotransmitters and hormone levels and address them with nutrients and herbs.
That's interesting. Do you measure neurotransmitters? I mean, I've never done that. I've heard of it, and I think it's interesting because that's really what you're treating is serotonin levels.
It is, but you're treating, for depression, the thinking is that it's the serotonin levels in the brain, and there's really no way of measuring serotonin levels in the brain. And I think for cortisol, the levels change morning to night, fluctuate so much that even when we're looking for other diseases, you can't really just take
on a random cortisol level.
Yes.
Right.
And as far as diet, I mean, I think diet's very important. Anybody that has any mental illness, we make sure they're sleeping well at night. We make sure they're eating healthy foods. We make sure they're getting multivitamins. I actually think that vitamin D, calcium, and fish
And
oil
it's
are
also
very important
to
for
know
your
about
brain.
family history because mental illness, depression runs in families.
Absolutely, it's very genetic.
So those patients, particularly, you would advise not eating foods that are high in preservatives.
No, that's more general.
Right.
Okay, to be healthy.
Right.
Okay, as far as
So then beyond that,
you have
a depressed child.
Right. Once you teach them, when you have depression, you can sleep more or sleep less, eat more or eat less. So you really want to work on that so that they have good sleep hygiene, that they have good diet habits.
Right.
But beyond that, if they have genetic depression and you're talking about serotonin levels in the brain, lots of times they do need medicine.
And so what would you prescribe a teenager?
And with medicine, though, always therapy. Always talking about it. Always.
Absolutely.
But if you're going that way, usually we start with SSRIs.
Which are serotonin reuptake inhibitors.
Selective serotonin reuptake inhibitors, right. So what they do, the neurotransmitters, so the cells in the brain talk to each other with serotonin. And when you block the reuptake of it, it just means you have more serotonin around.
So more serotonin circulating in the blood, meaning better
in your brain,
mood.
yes.
All right, and I think that might be difficult for a lot of parents to realize that their child's on an antidepressant. Are you worried about side effects in children? Do they vary for children? I mean, teenagers compared to adults?
And whenever we start any medication like that, we start the lowest, it's almost like you're not giving it, the lowest possible dose. And we go up very, very slowly, which is different, I think, than in adult medicine. You start higher. And the biggest side effect is fatigue.
Yeah, fatigue, somnolence, and sometimes some nausea
you're depressed,
and gastrointestinal problems.
You think it's not working, it makes you feel worse. So
but the most
really
important thing when you start a child on an antidepressant is to closely monitor them. Because the rate of suicide can go up
you just
after
feel worse. You
initiating.
feel a little more tired, yes.
After initiating therapy.
And if you go very, very slow, a lot of that stuff you don't even see.
All right. A lot of good information. We're going to take a break, and when we come back, the disease that some teens see as the scarlet letter and others see as a badge of pride, mononucleosis. We'll be right back. Oh, very good. I was glad we got the adaptogens. Everybody's been talking about rhodiola. It seems like to be very popular. Welcome back to Dueling Doctors, our Teen Trouble edition. Now it's time to talk about mononucleosis, or mono, that infamous kissing disease. Mononucleosis is caused by the Epstein-Barr virus. It's transmitted through saliva. It's called a kissing disease, but you can get it through coughing or sneezing or sharing utensils. Symptoms include fever, sore throat, and swollen lymph glands, especially in the neck. The virus has an incubation period of approximately 4 to 6 weeks, although the fatigue associated with mono can last months. Dr. Casetta, how do you treat mono?
Mono is a virus, so basically you do not need antibiotics for it.
So antibiotics will not work?
No. And a lot of the symptoms of mono are fatigue, so you need a lot of bed rest. So when patients come in and diagnosed with mono, we tell them 2 weeks bed rest.
2 weeks bed rest, get out of school because you're highly contagious.
Definitely no sports.
Okay. Why no sports? Tell us.
Well,
because it also it swells up your spleen.
Well, your spleen can get enlarged.
And you don't want to have contact sports because then you'll have a ruptured spleen,
right,
and you don't want that.
Yes.
Okay.
So no sports because of the fatigue issue and no sports because of the spleen issue.
Very good. Same question. How do you treat mono?
Well, I think rest is really important. Whenever we're dealing with a virus, we want to just help the body and help the person's immune system fight off that virus, is the way I think about it. And there definitely are herbs and nutrients that are shown to be antiviral. And some of the way they do that is helping the immune system create an immune response to a virus.
All right. For example, what which in particular?
Like vitamin C, which is easy to get at a health food store. With vitamin C, you want to do more frequent dosing, like 500 milligrams every 4 hours, for example.
Okay.
Zinc is another, maybe 15 to 30 milligrams a day. And then echinacea and elderberry are also easy to come by.
So really just those to help your immune system to support, but and bed rest, obviously. Are you concerned at all about other bacterial infections that are like concomitant at the same time? Do you test for strep?
You could be more susceptible.
You could be more susceptible. Do you check for strep? Because it presents almost the same way.
Yes.
Sore throat, swollen glands.
Throat swab. It's easy to.
You just do this throat swab and then not put antibiotics. You must be happy about that. No antibiotics.
Exactly. I love that. And it's, but at the same time, just knowing that there are things, even with a diet, avoiding sugar, because we know sugar lowers the immune function.
Right.
And back to those adaptogenic herbs, because we want the adrenals working at their best as well.
One last point. anything about adding steroids?
Steroids are necessary when you cannot breathe. I mean, I've had children that
because
can't.
they swell up so much they can really
tonsils,
occlude
yes.
the airway.
Yes, you
right?
need to breathe. So
steroids in those cases,
Right.
but only really in those cases.
in those cases, there are other severe complications like hemolytic anemia, which your blood levels really drop.
When your levels drop.
Yeah,
Okay, I
very
understand.
serious, but usually no steroids.
Well, you guys, we have to go. I want to thank you both very much for coming and
Thank
for
you.
sharing your wealth of
Thank you.
information.
Great. Thank you.
We'll be right back. Very good. I'm glad we didn't have to get to the steroid fighting, but
Yes.
no. I mean, do you really? Welcome back. We're in the home stretch of our Teen Trouble episode, and whether you suffer from acne, depression, or you just came down with a bad case of mono, the bottom line is that there are lots of options. Here's my spin. Growing up with acne can be humiliating and depressing. I recommend keeping your skin clean by washing it daily with a hypoallergenic cleanser and water. Avoid dairy products and carbohydrate-rich foods such as bread, bagel, and chips, which can increase blood sugar, which can then trigger acne. If your teen is showing signs of depression, I strongly advise parents to talk with their child. It is important to treat your child with respect and understanding. Offer them unconditional love and emotional support. Then consult with their doctor to discuss therapeutic options. And finally, mono or the kissing disease. There's no specific treatment and antibiotics don't work. Treatment mainly involves bed rest and drinking plenty of fluid. And wait until you've been cleared by a doctor before returning to contact sports in order to avoid a ruptured spleen. I'm Dr. Frank Spinelli. Hope to see you soon on Dueling Doctors for more healthy discussion as you explore the best path for your own personal prescription. And as always, be sure to talk to your healthcare provider before making any medical decisions. We'll see you next time.